Today I want to talk about one of my most favorite therapies, not bio-electrotherapy, although that's one of my therapies that I love the most. This is called emotional freedom technique, also called EFT. And I was taught this incredible therapy back in the probably in the late 80s, early 90s by a very famous therapist called Dr. Lee Poulos, psychologist, hypnotherapist, president of the Hypnotherapy Society. And he was a mentor of mine, and I'm so grateful for having got to know him and learn from him. But anyway, emotional freedom technique. And it's simple. It's so fast and so simple and profoundly effective for helping treat all this pain and anguish from these women that come into a treatment center. I'm employed at Heartwood Treatment Center. It's a 3-month program for women who are dealing with lots of trauma and addiction issues. Could be opioid addiction. It could be methamphetamine, cocaine, or benzodiazepine, or a lot of other legal medications too. They want to come off these things. And when they come off these things, a lot of the trauma and a lot of the memories and emotions starts to surface. It just wells up and it's overwhelming. And it's hard to cope day by day in a 3-month treatment program. We got lots of support and lots of different therapies that we do here. But for EFT. So again, not an hour ago, I was in a session with a woman, and as I did work on this one woman, 2 or 3 other women were listening to what I was doing. They were getting the equal benefits from the treatment that I provided this one woman in front of me. But it's based on acupuncture meridians and acupuncture points, and it's a matter of tapping or rubbing on these points. And what that does, this little bit of physical stimulation on the acupuncture points will create what's called a piezoelectrical signal that travels down the meridian and clears the energy pathways. And it doesn't take much. I mean, acupuncturists use needles. Bio-electrotherapy, I use electrodes. But I mean, in EFT, we just use the simple touching, tapping, stimulation to the acupuncture points, which triggers the release of any of the impediments or resistance in those meridians. And in this case, it could be emotional trauma, but it could be physical pain problems as well. But anyway, so here's how it's done. They're sitting, I get close proximity to the clients. They got their hands on their knees, and I just tap on their sides of the hands. This is called small intestine 3, and just tapping like this. It's a combination of EMDR and EFT, and I just asked initially, as I'm tapping, I just say, well, how much pain do you have? Scale of 1 to 10. Where are you at? And it's quite frequently 8, 10, 12, 20 out of 10. I mean, it's sometimes quite extreme. And so I get them, instead of saying, I deviate from the normal approach to EFT, and I say, rather than saying I accept myself or get them to repeat what I'm saying, I accept myself with all this heartache and sadness, feeling abandoned and alone and so on. I just say, because they have a hard time saying those words, I say, I acknowledge the way I'm feeling right now. Deeply and profoundly, I love and honor and accept myself the way I'm feeling. And I say that basically 3 times. So I know that it's a high level. I get them to acknowledge the problem, and I keep them focused on that issue. And then I start tapping on certain points. Now this is one. I just tap on the very top of the head, and it sounds, as their eyes are closed, it sounds like this galloping horses running across the plains. But as I'm doing that, I'm hitting about 2 or 3 points, key points, which help with emotional issues right up here. And then I come down to, just by doing even 1 point, I feel more comfortable and relaxed. But then I go down here. This is bladder 2. And I rub or tap, just gently rubbing on. It creates this electrical signal that cleanses and clears that meridian. And then I go over to here. This is the gallbladder meridian, gallbladder 2. A little tapping, keeping the patient focused on their issues. And then here, stomach 2. And again, the energy signal, the bioelectricity is traveling down through the stomach down to the toe. And then I move down to this one. And again, it's catching up with this meridian that comes from the tailbone up across the top of the head there. And then I go here, and this is one that comes up, this conception vessel that comes up from the perineum. And that's very powerful, connecting the yin and the yang. And then I go to here. Now these are kidney 27 right here. I feel 2 little spots. They're little divots, and if you just press a little bit, they just open up, actually. That's kidney 27. And this one is good for back pain, and again, a lot of anxiety and fears are associated with the kidney meridian. So a little bit of tapping, a little bit of rubbing. And when I see a point that seems to have a profound relaxation effect on a client, and you see it in their face, you see it in their whole body as they relax, shoulders relaxing and so on, and then I stay on that point a little bit longer. It could be this one, it could be this one, but you just be conscious and aware that some of these points will be the ones that trigger the release of the issues that they're dealing with. Then I go here, taking my hand like this, 4 fingers in a row. And there it is right there. There's a one spot that feels like a bruise, and that is spleen 27, I believe that's called, yeah. So you just tap on that and then come back to here, all the while repeating the issue in various words, key words that trigger the thoughts, that trigger the emotions, which get cleansed by this simple stimulation. And there, and there, and there, and there. Again, just being conscious and aware of their physicality, these words, these feelings, how they're just melting away and relaxing away, manifesting in this totally relaxed body. I've had, in a treatment center for men, I had a guy fall asleep right on the chair as I was tapping because he felt so relaxed. But as you relax, you actually, often I find that they enter a trance state. This is a light trance or sometimes a deep trance. And in the trance state, they're more able to process these subconscious mind, awake and aware and hearing every word, feeling every feeling, helps them process those particular issues that they're addressing. But so that's EFT. Now I recommend going online and seeing the Gary Craig video on Introductory Video EFT, Emotional Freedom Technique by Gary Craig. It's a powerful visual experience, and it shows you a lot about the theoretical basis and a lot of people being treated for different things from, you name it, traumatic physical pain problems and diseases and conditions to emotional issues and traumas of all kinds. So do go there, and I often follow up this with a bit of trance work, deepen the trance and do a little hypnosis and load people up with the positive affirmations and witnessing the transformation in people and how they're feeling and how they're sleeping and, releasing and relaxing the craving and anxiety and a lot of the pain. And so it's a wonderful experience, a wonderful therapy, and it's so simple and easy to learn. And I would recommend it to anybody who works in the field of addictions, anybody who wants to treat themselves. You can do it yourself. You got the tools right here, and all it requires is knowing 8 points: 1, 2, 3, 4, 5, 6, 7, 8. And going back and doing it again and just cleansing any residual resistance in those energy pathways. Yeah, so anyway, that's a wrap for today. And the next video I will maybe, we might even talk about rapid induction techniques to get into even a deeper trance state. I believe in a deeper trance is better than a light trance, although both work. So enough for today, and I look forward to seeing in the future, and looking forward to presenting many of the other therapies that I provide for women, men and women, and anybody with addiction problems or complex pain issues. It's never just one therapy that's going to be all, end all, do everything that they need. But Okay, so take good care, have a good day, and we'll see you again in the future. Thanks. Bye.